The Reinier de Graaf Hospital is ready for you, even during the time of coronavirus. You may be wondering if it's safe to come to the hospital. We understand this question. We're making every effort to ensure that patients and employees in our hospital are safe. We have taken various measures to protect everyone in the Reinier de Graaf Hospital and at our other locations as effectively as possible against coronavirus. In this film, we show a number of measures. You will be affected during your appointment at the outpatient clinic, during your hospitalization or medical examination. You enter through the main entrance. Here, one of our employees will ask if you have health complaints that resemble coronavirus symptoms. If you have no complaints such as coughing, sneezing and fever, you can proceed to your appointment at the outpatient clinic, your admission or examination. If you do have complaints, you will receive a face mask and go to your appointment with the mask. You will continue to wear the mask until you leave the hospital. When you are in the hospital, you will see information about our rules of contact everywhere. This way we can remind everyone of the 1.5-meter distance from each other. A maximum of 4 people can ride in the elevator at the same time. The waiting room is arranged in such a way that everyone can keep their distance. We ask you to be in the waiting room no more than 5 minutes before the start of your appointment, so we can limit the number of people waiting. We are happy to welcome you in the hospital, but as a precaution, you are not allowed to shake hands. In the hospital, we only wear personal protective equipment such as gloves, a nose mask and/or splash goggles when the situation requires it. Our healthcare providers only work if they have no complaints themselves. To limit the number of patients in the hospital, appointments are made by telephone as much as possible. The doctor can also hold a video consultation with the patient. If a physical appointment is necessary, you will be notified by us. Patients diagnosed with the coronavirus are admitted and nursed in separate wards, in isolation. Measures to prevent contamination between people remain necessary. Therefore, as a patient, you may receive 1 visitor per day and a maximum of 1 supervisor may be taken to the outpatient clinic or emergency room. Visiting appointments are tailor-made for corona patients. All of these measures help best if we stick to some important hygiene agreements. Wash your hands with soap and water before and after your visit to the hospital. You can wash your hands anywhere in the hospital. Do not shake hands, cough and sneeze into your elbow, and use tissue paper. And of course, we keep 1.5 meters apart. Together, we keep healthcare safe. For more information, visit www.reinierdegraaf.nl.